Hello, today I will talk a bit about skin picking, hair pulling and OCD and how these can be related and how they might be treated in the same way with a new technique called habit reversal training. Okay, skin pickers, they usually feel an urge to pick on their skin. It can be small pimples in the face, on the back, on the arms, on the legs. And quite a lot of people have this problem, around 1 to 2% have it in such a way that it becomes a problem in their lives. Almost all people do this from time to time, they pick on scabs and things like that. Hair pulling, same thing, around 2%. Actually pull out their hair until they get bald spots. So if you have this problem, in a way you're not very abnormal, all animals do it, but it's a question of degree. It's just like OCD. Some people become hand washer OCDs and they wash their hands for several hours per day. That's clearly too much. But usually it's good to wash your hands before you eat and after you've been to the toilet and things like that. So it's a normal behavior that becomes extreme. That means that there's a lot of hope for getting it down to a normal level again. And one of the things that you can do to get it back to a normal level is to do what we call habit reversal. That means that when you're about to do the offensive behavior, for the skin picker it will be to pick that scab, for the hair puller it will be to find that right hair and pick it, and for the OCD hand washer it will be to wash the hands one more time, for the checker it will be to check one more time, etc. So you know your symptom, you know what kind of problem you have. So, very simply put, and habit reversal is very simple, is that instead of doing the action that you want to do, you should do the opposite. Okay? So, if we take it for the hair puller, in a way you should do an action that is opposite in a way, or if you can't find a really opposite way because you can't put the hairs in again, that would be the opposite. But the opposite of pulling the hair is not pulling the hair. And if you can do something to not pull the hair, like holding your hands like this with the thumb inside, then you won't be able to pull your hair. So this is actually the thing that we suggest for hair pullers and skin pickers, is that the moment you feel the urge and you're about to go and pick or pull, you close your hands like this. And you hold them for at least a minute or until the urge to do it is gone. Then you can release and just wait for the next opportunity to learn. That means the next time when you get an urge, close your hands like this as quickly as you can. The point is that your brain will learn little by little that this urge should lead to the action that is opposite the bad behavior in a way. And you can close your eye, you can close your hands very gently like this. You're taking care of yourself by gently holding your thumbs. It's not supposed to be like fighting fists or anything like that. Okay, for OCD, it's a little bit more complex, but just thinking about it as doing the opposite is a good idea to understand what you're supposed to do and what will cure you. Because it seems like, nah, I can't do that. That would be horrible. So, for instance, for the hand washer, what would be the opposite behavior of trying to wash your hands until you feel completely clean? It is actually making yourself dirty. And that's what we suggest for people who have OCD washing, is that whenever you want to wash, rather make yourself more dirty. Touch something dirty. If you have fallen for the temptation and washed your hands again, you're supposed to re-expose yourself by touching something dirty. And then you go on with your work without washing again. So for the hand washer, it will be making yourself dirty. For the one who checks the stoves and things like that, and checks if the door is closed, it will be to put on the stove completely, and while you're being distracted by somebody talking to you, you You turn it off very quickly and you go out and you lock the door very quickly and you go away. Or the opposite. Okay. There was one doctor actually who was afraid of anything that had to do with AIDS and hepatitis, and especially to do with drug addicts. And he went with an OCD therapist and got exposure in a park where there were a lot of drug addicts. And at night, he started thinking, "Oh, what have I done? What have I done? I've touched things in the park that might be contaminated. Wow, this is horrible." So he wanted to reassure himself. He wanted to call his therapist in the middle of the night and ask for reassurance if this was okay. Okay, so he wanted reassurance. What should he do? Make it worse. Go the other way. So he went and found the boots that he had worn in the park, and he brought them with him in his bed. Sounds crazy, but it's the opposite. Okay, what if you have thoughts of stabbing your kids, for instance? This is a classical OCD thought that scares people crazy, and you are so ashamed if you have these thoughts. Okay, what can you do then? The opposite of what you normally do. You try to get the thought away, try to block it out of your mind, try to not have it, and that's what makes it stick. So, in a way, what you could do is say, I'm just going to really imagine this thing. And then just show that I'm not afraid of it. You have to show your instinctual brain. Okay, it doesn't understand language, so you just have to show it by example that you're not afraid. So it could be, I'm going to take these images and look at them carefully, and that's one thing. The other thing is the opposite of getting involved with these images, trying to reassure yourself that you will never do this, is to say, I'm not going to engage with these pictures. Yeah, they're just pictures, they're just thoughts. People have them. But in a way, not to engage in very reassuring thing, because it usually doesn't work. When it has come above a certain level, it doesn't work to just reassure yourself. Okay, so habit reversal is the thing. If you can use Tourette as a model, for instance, a Tourette sufferer who jerks his head back, what should be his opposite behavior? It's moving the head slowly forward. If there is like a pressure building up in the neck, if that is the urge to do the tick, one of our patients, he said, I just imagine that the pressure goes out. And that was actually enough to stop it. Another person said, I just imagine my urge going out on a cloud. And who knows, maybe we can use these kind of things for skin picking and hair pulling too. No, and for OCD too, in where you feel that the thought is just fizzling out, going out on a cloud. That's actually mindfulness in the use of OCD, that if you get some bad thoughts, urges to wash your hands, in a way, see that your hands are dirty, okay, let this urge go out on a cloud that drifts by. Or let it fizzle out if it feels like a pressure. Okay, so there are many things you can imagine that, they just go away. One thing that can work for these sexual or aggressive thoughts that can come in OCD is the same thing. It's just a thought, so it can drift away on a cloud. Or another thing is just take it and look at it really closely, the horrible image that you want, and then you can send it away straight out and take in a good image of yourself who's so happy that you're finished with the OCD or skin picking or hair pulling. In a way, there are many ways you can treat the images and urges that you get. But basically in habit reversal is doing something else, training the brain to go in a different direction.